a very interesting condition that we see here at the office is Eagle and Ernest Syndrome. It involves traction injury to the stylomandibular ligament, which can cause some incredible symptoms like problems with the cranial nerve, specifically the glossopharyngeal, vagus, and hypoglossal nerve. This ligament, the stylomandibular ligament, when it's affected, it's called Eagle and Ernest Syndrome. The styloid process is this little bone here. See that little bone? It's right below the TMJ joint. It's right here, and there's a ligament that goes from the styloid process to behind the mandible. That's called the stylomandibular ligament, and it's actually a really important ligament, even though it doesn't get a lot of publicity. That ligament is important, especially now that we use cell phones. So because we use cell phones, that ligament is a ligament that's preventing you from being like this all the time. See, like, because that ligament will hold up the mandible. So imagine like how much stress that ligament is under, because many of us, right, because of gravity, we're now like this, we're not like this with our muscles contracting, we're like this, and we're looking down at cell phones, and that ligament is under traction and under traction and under traction. And when there's pain on the mandibular attachment of it, it's called Ernest Syndrome. And Ernest Syndrome was named after a dentist about 100 years ago, Dr. Ernest. And when the ligament is affected at the styloid process, that's called Eagle syndrome. Eagle syndrome is also when the stylohyoid, there's a bone right here, you can move it around on yourself. That bone is called the hyoid bone. That's the origin of the tongue muscles, right? What moves the tongue, all those muscles, they have their attachment onto the hyoid bone. So you can understand stability of the hyoid bone is really important. So when the stylohyoid ligament is affected, or the stylomandibular ligament is affected at the styloid, that's called Eagle syndrome. Eagle syndrome was named after Dr. Eagle, who was an ear, nose, and throat doctor. Now these are ligaments, so these are ligaments that can be treated with prolotherapy, but sometimes the traction on the ligament, especially the stylomandibular ligament, again, people are like this, they're not contracting muscles really, the jaws, being forced here, so that ligament is under traction, and when a ligament is under force, and it yanks on the bone, you get an overgrowth of bone. That's what causes bone spurs. Heel spurs, spurs in the spine, they're called osteophytes in the knee. Bone spurs are because of traction on the bone where the ligaments attach. So imagine what's going to happen to the styloid process if it's yanked and it's yanked and yanked. It grows. It grows and it grows and grows, and eventually that can grow so much that it can impinge on the vagus nerve, the hypoglossal nerve, the glossopharyngeal nerve, where people with Eagles and Ernest syndrome not just have pain, but they can have headaches, they can have heart arrhythmias, they can have swallowing difficulties, speech difficulties. All cases of Eagles and Ernest syndrome that come in, that people think they have it, they always say they got tenderness here. So in other words, remember I said it's right below the TMJ joint, so this is a TMJ joint, so you just go below it, you have the angle of the mandible here, then I have my TMJ joint there, so there's the mandible, the edge of it, and then here's my TMJ, so you have to go, just slide down, and if you have a lot of tenderness right there, you're getting stylomandibular ligament laxity, and you better stop the face down lifestyle. But you can understand when patients come in with suspected Eagles and Ernest syndrome, we have to look at the TMJ. So we're looking for clicking, popping, grinding on the TMJ. Then I have to do a digital motion x-ray because we have to see if they have cervical instability, because cervical instability can compress, stretch the very nerves that also Eagles and Ernest syndrome can. So after assessing the tenderness at the stylohyoid or stylomandibular ligament, again, tenderness at the TMJ, the neck, and then doing dynamic testing. So we do high resolution ultrasound testing in the office here where we can actually see the stylomandibular ligament, look at the TMJ, then do digital motion x-ray of the TMJ and the neck. After that, then we assess what's needed. But all these areas can be treated with prolotherapy. Prolotherapy is very effective for Eagles and Ernest syndrome, but a lot of people who come in, they also have other issues. They have TMJ and or neck symptoms. A person only needs surgery if the styloid is really, really big. It's really, really big and it's compressing some of the more important nerves. And as I said, the nerves that go to swallowing is the glossopharyngeal and vagus nerve. So a large styloid process can compress those. Also, the large styloid can affect the hypoglossal nerve, which is the nerve that innervates the muscles that move the tongue. So anybody who's having difficulty moving your tongue, you have to get assessed. Have to get assessed for this. Now, prolotherapy is a series of treatments. Normally it takes anywhere from 3 to 8 visits to resolve Eagles and Ernest syndrome. But like I said, the person has to get assessed for the various other joint instabilities. So if you're somebody who you got tenderness here and it's really causing a lot of symptoms, please get an evaluation by an experienced prolotherapist and consider getting prolotherapy for your condition.